31st. The following establishments are closed effective immediately until March the 31st. All facilities providing indoor recreational programs.
Oh, man.
All public libraries. All private schools as defined in the Education Act. All licensed child care centers. All bars and restaurants, except to the extent that such facilities provide takeout food and delivery. All theaters, including those offering live performances of music, dance, and other art forms, as well as cinemas that show movies and concert venues. Again, this order will come into effect immediately. I want to be very clear about what this means and what this doesn't mean. This is not a provincial shutdown. I repeat, this is not a provincial shutdown. The vast majority of businesses, including those most vital to day-to-day life, will not be affected by this order. Essential services and essential needs will be available to every individual and family. Groceries, convenience stores, pharmacies, manufacturing facilities, public transit, important public services, construction sites, office buildings will all continue to operate. Right now, we need to do everything possible to slow the spread of COVID-19 in order to avoid overwhelming our healthcare system. The health and well-being of every Ontarian must be our #1 priority. We must think about our children, our parents, and our grandparents. We must think about our neighbors, our colleagues, and our friends. We must think about the elderly, those with health issues, and every other person across this province. All of these people have been in my heart and on my mind with every decision I've made during this crisis. It is imperative we protect every person and every family across this province. We must act decisively, and we must not delay. As COVID-19 continues to spread, the government must be in a position to take any and all actions necessary. That is why today, Ontario has declared a state of emergency. As I've said all along, we've been preparing for every scenario. This decision was not made lightly. It was based on the advice of our Chief Medical Officer of Health and public health officials. Our cabinet deliberated late into the night and again very early this morning. As we take action to fight the spread of this virus, I want to assure the people of Ontario their government is taking every step possible to flatten the curve. We're taking the steps necessary to protect you and your loved ones. We're taking these measures now while our system is strong and to ensure it remains strong in the days and months ahead. I want to urge calm across the province. No expense will be spared to support Ontarians in need. There's no level of support we won't consider. By declaring a state of emergency, our province will be in the position to act as fast and decisively as needed. Again, this decision was not made lightly. We've seen around the world that jurisdictions like Ontario, who take timely and decisive action, have so far stayed ahead of this virus. We must flatten the curve and help stop the spread of COVID-19. We understand this decision will impact workers across this province. My message to these people is that we will support you during these difficult times. We expect the federal government to support Ontarians with the following measures. They must work with us to establish a loan program to support businesses. Immediate EI reforms must be implemented to support workers. The eligibility criteria must be expanded to include workers impacted by this outbreak. In Ontario, I've directed our cabinet to look at all options necessary to support the workers and businesses during this unprecedented time. That is why today I'm announcing the first stage of our COVID-19 emergency relief package. This is over $300 million committed to supporting the fight against COVID-19. This is the first stage of our larger emergency relief package. Our ministries have been working around the clock to develop a plan that can be implemented as fast as possible. This initial investment of $300 million for immediate measures to protect the health of Ontarians. This funding will also help us protect our seniors and the most vulnerable during this difficult time. We're going to bring 75 more critical beds online, 500 post-acute care beds, and help hospitals set up 25 more COVID-19 assessment centers. We're backing up our frontline public health workers with more resources for monitoring and testing. And we're purchasing more personal protective equipment like masks, gloves, surgical gowns for our nurses, doctors, and personal support workers, as well as more ventilators. For our long-term care homes, this funding will provide 24/7 health screening support for staff and visitors to help protect our seniors, as well as additional staffing for infection control and cleaning supplies at these homes. We're supporting our health professionals. We are providing funding to backfill 1,000 nurses, 1,000 personal support workers to support capacity during the outbreak. We're also providing funds for 50 physicians to cover emergency departments, urgent care, and primary care in Indigenous, northern, rural, and remote communities. We listen to the frontline workers, and this surge funding will back them up in the fight against COVID-19. In addition to the public health measures we've introduced today to keep everyone safe and healthy, and our legislation to provide job security to workers and families, and certainty to businesses. As I've said, we will spare no expense to support Ontarians. This is the first stage of a larger emergency relief package. In the coming days, Ontario will face challenging times. We must come together as a province. Every Ontarian must support each other. I and the entire government of Ontario will do whatever it takes to guide our province through this difficult time. For years, Ontarians have led the world in healthcare, research, business, and ingenuity. We have the greatest minds, the greatest businesses, and the greatest people in the entire world. Ontario will weather through this storm together. Ontario will come out of this stronger than ever before. Thank you, and God bless.
Okay, we'll take questions.
And we just heard Premier Ford there announcing a provincial state of emergency as we continue to grapple with the COVID-19 pandemic. Let's go live to our Jamie Pulfer ahead of a news conference later today by the Prime Minister. Jamie.
Yeah, Catherine, Doug Ford says we are currently facing an unprecedented time, and this decision was not made lightly.
This morning, I've declared a state of emergency in the province of Ontario.
So what does this mean exactly? It means no public events of 50 or more people until March 31st, closed immediately. Our rec programs, libraries, private schools, child care centers, bars, restaurants, although those bars and restaurants are still allowed to offer takeout and delivery. Movie theaters also closed right across the province. This comes into effect immediately. Now, Ford was quick to say that this is not a provincial shutdown. Vital business businesses are not affected by this order. Things like grocery stores, pharmacies, transit still available. He says that we need to do everything possible to stop the spread of COVID-19 so we don't overwhelm our healthcare system, saying to think of others, parents, grandparents, kids, neighbors, co-workers. Protecting people here is the main concern, and this gives the province the power to act as fast and decisively as needed. So once again, a state of emergency declared over COVID-19 in the province. Reporting live, Jamie Pulford.